I gotta get a group of people together and try that. I've never done anything like stomp. It sounds so fun.
I know, right?
It does.
I mean,
Hey.
I've always been at like a stadium. That's always fun.
Yeah. This sounds like a new project, maybe. Hey, everybody. Dan and Janice here on Drumming Injury Talk. This is where we talk about a wide range of not just repetitive motion injuries, which not only affect drummers, but other musicians and even those who work in other industries. You're all welcome to listen and learn. But we also talk about other types of injuries. And today's focus, and Janice is happy to answer questions about the many things we cover, like carpal tunnel, sciatica, all those different things. But we're going to focus on the shoulder today. So many drummers, especially later in life, a friend told me, have troubles with their shoulders because of drumming. And I think 90% or more of the time, Janice, that's because of their setup.
That's right. So sorry, I cut out for a second.
That's
I
okay.
came back. So I missed that last part. So
Yeah,
what were you saying?
We're focusing on the shoulder injuries today. And I was saying that I think 90% or more shoulder injuries in drummers are caused because of their setup, the ergonomics that are causing them to reach too far, reach too high, different things like that. And we're going to pull up Janice's program that will help literally illustrate what happens. So I'll put that up, and Janice, it's all yours. Kind of lead us through what gets injured and what have you learned through. And for those of you who don't know, Janice is a PT, a physical therapist that works only with musicians. So she has a lot of experience in this area of expertise.
That's right. And did you know, fun fact, that the shoulder is my favorite area to treat?
I didn't know that.
Did we ever talk about that?
Well, I don't ever remember hearing that. And why is that? Why is it your favorite part?
Well, because the reason why I became a physical therapist in the first place is because of my history with shoulder injuries related to playing the violin.
Oh, wow.
Yeah, so I can show you. So this is the shoulder here. And so kind of to answer your question, there's a bunch of missing stuff here. But to answer your original question, drummers, I do see a lot of drummers who have shoulder issues, and most of it is overuse related. But then if we talk about kind of like the aging drummer, which, no one really wants to talk about because we're all going to be like 20 years old forever, right? But, things tend to get stiffer, and like the elasticity of our tissues.
And more mileage put on it.
Yeah, there's more mileage, more wear and tear over time. So, there's a lot of different conditions that drummers specifically I've seen kind of over the years and across the lifespan. But I see a ton of shoulder injuries or shoulder issues with just musicians in general. So yeah, this is a model of the shoulder. So if you wanted to take a look, so I had a surgery on my left shoulder where they actually went in and shaved off. Let me hide this guy here. They shaved off this corner of my bone.
Wow.
Because it was kind of like grinding against my rib cage. We can talk about that a little bit and kind of like what I know now of like why that happened and everything like that.
Yeah.
Did I need to get the surgery to fix that? Probably not, but I didn't know that at the time, and that's not anyone's like fault because at that point I had basically run out of options. So anyways, this is a shoulder. Let's flip it around so maybe we can see a whole shoulder. So yeah. So the interesting thing that I always want to highlight to anyone who has a shoulder, which is like all humans, right? And I mean, even dogs and monkeys and rabbits and all that, is that our shoulders actually are this amazing complex. So sorry, I'm like kind of jumping around a little bit, but what people typically think about the shoulder is like our wing, our shoulder blade, or technically termed the scapula. So it's like this flat bone that sits on top of our rib cage. if we kind of peel this away, right? So it's this triangular bone that sits on our rib cage. And then we also think about our shoulder, like our arm being attached to that. So if we look at it from the side here, you see that this is like a ball and socket type joint, very similar to our hip joint. Now, the main difference, and you think about our hips have a lot of flexibility and movement, but our shoulders have even more flexibility and movement because the cup portion of the hip or of the shoulder is really not that deep. It's pretty shallow. So it actually allows us to have really great flexibility of the shoulders. But what I think usually blows most people's minds are two things. First of all, is that the shoulder complex, so we're talking about the shoulder blade and then the humerus, this long bone of the upper portion of your arm here. And then there's one more bone that is associated with the shoulder complex, and that is our
clavicle.
Right. So we have 3 of these bones that make up our shoulder. Most people kind of forget about the collarbone, but what is the most significant is that our entire arm is actually only attached to the rest of our body through the clavicle, through this point where the clavicle here meets our sternum, our chest bone, our breastbone. And actually what happens is that the shoulder blade is actually this floating bone only attached through the clavicle to the rest of our body.
It seems suddenly so fragile.
Yeah. And so you can see how there's like so many moving parts. So that was the first thing that people usually like their brains a little bit when I talk about that. I'm going to pose a trivia question to you. And if you ever get this in trivia night, you can thank me later.
Okay.
But how many muscles do you think attaches onto the shoulder blade?
I'm going to say 2.
No, go higher.
12.
Higher.
Wow. 22?
Maybe a little less.
17.
You're right. Yeah, it's 17.
Wow.
17 muscles, right?
Wow.
So if you look at, so I've kind of, obviously I've stripped away a lot of the muscles here, but if we kind of go.
But I see now from the back. Yeah.
Right. So this is like the most superficial layer. And then we go a little bit deeper. We hide that. You see all these other muscles here, here, here. You have muscles from the neck that attach on the shoulder blade. You have, so
what was I thinking? 2? People are like, does this guy know where his belly button is? 2?
Well, if you want to see that, no, I'm just kidding. Well, so the point being is that, so we now know that like the shoulder complex is really anchored right here to our body through our sternum, our breastbone here. But
you know what? Wait, I'm sorry. Just a quick note that I goofed, and we're going to continue, but I forgot we were going to do lower back.
It's all good.
Which we'll get to, because that's what all the promotional stuff was. And Janice and I got real excited about the shoulder, and then our producer corrected us, and then we launched into the shoulder. So we're going to cover the shoulder.
It's all right. I was there. I could talk about any body part you want me to.
Okay.
No worries. All good. So yeah, I mean, we can switch and talk about the back if we want to, but we can save that for another day. But yeah, so the shoulder blade is really anchored to the rest of our skeleton only through the breastbone. But then where our shoulder blades sit is really at the mercy of every single one of those 17 muscles pulling in different angles to get them to sit in the right spot.
Wow.
Right.
That's
and
amazing.
So it really is really amazing. Which, you know, I could have picked a simpler joint to really get geeky about, but here we are.
The most flexible part of the body because of that? Like, and when I say flexible, I mean because of range of motion and whatnot?
100%. Yeah, absolutely. Yeah. And that's what is kind of like the miracle of the mechanics of this region of our body, is because we wouldn't be able to reach in all the angles that we do without that one spot. Or imagine if you were anchored in more areas or more deeply anchored, right? We wouldn't be able to do that. Think about, another animal that's not built like us, maybe like a dog, for example. Like they
Yeah.
have some flexibility, they have some rotation, but they can't reach the way that we do.
Right.
So it's really a cool joint to be thinking about, or a
Yeah.
series of joints, really. But yeah, so if we look a little closer at the joint itself, so let's maybe take this guy away. Let's take some stuff away. Okay, so if we look at the shoulder joint here, right? So we have the humerus, which is the long bone, like the upper portion of the arm, and then we have the shoulder blade, which is like the cup portion. And so let's see, let's make some stuff move so you can kind of see how the joint works, right? So let's take this away. So you can see,
And
like, sorry, you were going to say something.
yeah, well, I was going to say after that, I do have a question, but this is fascinating. Yeah.
Yeah. So you can see as the arm moves relatively, it kind of spins within that cup,
Right.
right? But then what also allows for even more motion is that the shoulder blade also has
Moves.
a
Yeah.
portion of movement within the total, like, net movement,
Right.
right? And so when people lack mobility of either the shoulder joint here, or maybe the shoulder blade doesn't move upward, like rotate upward or downward, or maybe it's like already stuck outward, and we can talk about maybe some reasons why that happens in a second. When you decrease the mobility in one or both of those joints, that can cause to more overuse or kind of like pinching of the joint, just because you kind of reach the end of your range of motion much quicker than if you had both parts kind of fluid and moving appropriately.
Oh, okay. I think that's kind of related to the answer, maybe to what I was going to ask, which is,
Hmm.
you know, you've seen, and I know of a lot of drummers who have had shoulder replacements or surgeries
Oh,
because of
yeah.
years and years of cymbals being so far. So my
Yeah.
question is, why is it that if we have that range of motion, what's causing the injury if we have that range of motion? You know what I mean? Like if they can, it's like if I can do this, how would it get injured? But I'm asking at a much more extreme level, of course.
Yeah, I mean, of course, there's like a lot of different scenarios, right? But probably one of the main things, like, let's assume that their joints, so their shoulder blade moves perfectly, their scapulohumeral joint, or no, sorry, scapulohumeral joint, which is like the long bone and the scapula, move perfectly. Like on paper, they have great motion.
Mhm.
Then you want to think about where the breakdown happens. And this is the same as like any other like body part. I always like try and it's kind of a simpler way of like looking at things, but I try and bucket them into 3 different categories. Do you have the flexibility? Do you have the strength? And if you have both of those things, then what is your brain telling? How are you moving? Like, how's your coordination? Are you moving in the way that is the most efficient for your body to move? Or have you chosen a different avenue to do the thing,
Right.
but maybe it's not the most ideal way, but that's just kind of how your body naturally went. Um,
Got it.
so
And
that kind of hopefully answers like your
yeah,
question, kind of like in a more macro way.
it
Um,
does. And I'm wondering how much this factors in. This is from 905 Alive watching live on YouTube, is saying it's very important to stretch before playing. And also, as we get older, to do some yoga. I'm going to let you answer that. And then I'll say something that you'll probably yell at me for.
oh, I want to yell at you now, though.
Okay. This is common. Um, Okay, so I'll give you the comment first, and then please, let us
I'm
know.
just teasing, but
Not
yeah.
that's okay. 905 Alive, what your position is on. I am 62. I've been playing 55 years. I've never stretched, and I'm not saying it's not needed. That's not what I'm saying. I'm just saying if it's needed, I never wore hearing protection either, and I'm paying for it, and everyone around me is paying for it. I've never stretched, and I'm never sore after playing, but I have very lean muscle mass, and maybe I have some things working for me that factor for that or not. Maybe it's all the more reason I should be stretching. And I'm not saying 905 is wrong. I'm saying, can you let us know the position on that and how dumb I am for not stretching?
Well, so stretching in general is really good because you need to make sure that you have the right amount of mobility in your joints to allow you to do the things that you want to do, right? And so stretching addresses the joint, but then as you see here, like there's 17 muscles that can affect how your whole shoulder complex works. And so if you have tightness in one muscle, that's going to throw everything else off its balance, right? And so stretching in general is really good. And for most musicians, I always encourage people, and most people in general, but like I encourage everyone to think about what position or postures you're in the most and then stretch out of that, because your body will kind of just adapt and kind of like mold into that. And it's going to learn how to work really efficiently in that manner. That's why you see so many people just kind of like shrunken into like shrimps, right? It's because you think about what we do every day. If we're sitting in front of a computer or a keyboard or a drum kit, like everything's like in front of us. We're not like really reaching out. I mean, some people, like some drummers have like their setup where they're reaching, but most of the things, like the bread and butter of what we do is like in this very narrow range of, movement. And so our muscles will then adapt to that. Now, stretching in general is great. I think it's really important for mobility. It's really good for flexibility and has a lot of other benefits.
But there's a difference between, I believe, static and dynamic stretching and when one should do that, right?
Yeah, that's exactly where I was going to go with that. So there's two main forms of stretching. Well, really there's three, but really you don't want to do the third one. So there's static stretching, which is kind of what most people kind of associate with stretching, where you're like holding a position for like 30 seconds or a minute in one position, and you're like allowing the muscle to kind of like relax into the stretch. Then you have dynamic stretching. So if we're going to stretch the side of my neck, maybe that would look something like this, where I'm just kind of like going back and forth through the range of motion, maybe getting to the point of where I start to feel a stretch, but I'm not really like staying there for a long period of time. Or if I'm going to try and stretch out my shoulder, like my pecs, for example, it could be something like where I'm like reaching up and back and then back down. So I'm never really like holding it in one position for a long time. The third one is called ballistic stretching, which is like through research has just been shown to be, higher likelihood of injury rates, et cetera. So just don't do it. But that's basically where you're like aggressively bouncing back and forth through the extreme ranges of motion. So don't do that. So it's kind of like ballistic stretching is more of an aggressive dynamic stretch, I guess, is how you could like look at that.
Is that something we see like in real active sports, like boxers probably do it, NFL players probably do it, soccer players probably do it, or no?
Ballistic? No.
Okay.
Across the board, it is just not advisable. What you see elite athletes doing, if you watch like a warm up of like an NFL game, then you see them kind of like hugging their knee towards their chest. They're like going up and down the field. Those are all examples of dynamic stretching.
Okay.
All.
Got it.
And so doing dynamic stretching before some kind of intense movement, so maybe before a gig or before a practice, before a workout, before a game, right, is actually the most desirable method of stretching.
Okay.
And the reason why that is that when we do a static stretch, and this is not to be taken in a negative way, but when we do a static stretch, what we see is actually a small decrease in the muscle's ability to perform, or like the relative strength that muscle can generate. And it's a very temporary amount of time. And, like musicians, they're not like lifting, 100 pounds with their fingers or something like that. This is more for like, if you're going to go play soccer for an hour, like you don't want to stretch out your quads like aggressively, like in a static way before you go out on the field. You would want to do more dynamic. Dynamic is a little safer. You're just kind of teaching the muscles to go use the whole range of motion. You're warming up the tissues, et cetera, which also helps make the muscles more pliable to get a good stretch out of it. So there's a time and a place. Stretching in general is great. There are some people who are really flexible where maybe stretching is not necessary or not as necessary. But that's like a whole nother conversation. But yeah, so long story short, dynamic stretching before an activity, before playing, before a workout, before, doing something more physical, and then static maybe afterwards as a cool down.
Maybe I should start to try these out, but I'm going to, for now, 905 Alive says thanks. And Barry Ross watching live on Facebook, I'm going to attach myself to this. Here's how I'm going to rationalize me not stretching in 55 years of playing drums. He says, not everybody works the same. Some are lucky and stay in good shape. Thank you very much. And others need to warm up their muscles for a gig. I think the reason why I have lacked in this area is, quite frankly, I don't think of it, and it never became a habit. And I'm rarely sore after I play. Once in a while, I feel, it's funny, I was going to call you about this. Once in a while, I feel a weird pain right here in my left hand, and I mainly play match grip. And it goes, but other than that, it's not like I finish playing and go, oh man, oh God, I should have stretched. I'm just so beat up. So maybe I'm just one of the lucky ones, and maybe being so lightweight, I'm 152 to 4 on a really great day, and lean muscle mass. Maybe that's part of it. I don't know. I don't know how much that has anything to do with it.
Everybody's.
My fascia is really good.
That's really important. That is actually really important. Is it the only reason why you feel fine when you play? Who knows?
Right.
But, I think if you think about it, a lot of musicians resist the notion that they're like athletes. And I don't mean them that they do
why?
I don't know.
Especially drummers.
It's gotten, I think that conversation's a lot more accepting now than they were like 20 years ago. But there was a big resistance back in the day when I first became a PT. Really? But people who start sports at an early age, right? I started tennis when I was 6. I played softball and whatever. There was always emphasis on stretching and warming up and all that. Like musicians, there's different levels of training, different amounts of emphasis on it, but very few musicians until recently have gotten much education on how their bodies work, or yes, warm up, but warm up usually for almost all musicians is just more playing. It's not warm up to tune up your body, that kind of thing.
I would guess
movement.
Yeah. And I would guess that the least amount of musicians who would adopt stretching might be those who, in a way, need it the most because they're more prone to repetitive motion injuries. And I'm thinking of piano keyboard players never stretching or paying attention to that with their hands or fingers, and any other musician that mainly uses, most of their efforts are concentrated on this. That could be anything from a valve player of any kind, strings, even guitar player, rather, is that correct? And they're playing stretch. I'm just using my fingers.
They're like, oh, stretch. Okay, I'll do this stretch. I'll just stretch. I mean, you are correct. I mean, most musicians that I've encountered, and, I'm guilty of this too, when I was, coming up and working and all that stuff, is most musicians are very hyper focused on what's happening from basically here to here.
Yeah.
But as we saw with our shoulder girdle, we don't have here to here unless we have this too, right? And so and then we don't have this unless we have our core. We don't, there's the neck bone's connected to the toe bone, whatever.
Right. Exactly.
So I forget where I was going with this, but I would say it's So there are a lot of people who are very fortunate and who are very lucky who, for whatever reason, and no one really knows why, there could be some like hypotheses as to why, but like some people just never experience injuries, right?
Hmm.
It could be that, you know, you are moving very efficiently for your own body and that you have the right flexibility in the right areas. There's just so many different like factors.
Yeah.
And then you see people, and I know we've like had some segments on this before, who have like kind of on paper atrocious postures, and they
Yeah.
play, not only do they play amazingly, but maybe they don't have pain either. And
Right.
why is that? Right. And so it's not to say that, oh, you have quote unquote bad posture, you're going to have pain, but you kind of have to think about all these other factors. And why wouldn't you want to make your body the best that it can be so that you can play the best that you want to play?
And feel the
Right.
best you could after playing.
Right. And so if you're so limited because of flexibility or whatever, or strength or something like that, then you're going to just reach your ceiling much, much quicker. And
Yeah.
then you just have all this untapped potential that is like locked up in your body that you would never be able to discover or, explore, because you just don't know it exists, because you're never
Yeah.
going to get there in the first place.
You created your own cap. Those are great points. I want to read a couple more comments and then we'll talk a bit about the lower back, which is also a common issue.
Yeah.
Gerardo Ubieta, how you doing, brother? He says, hi, Dan. This is most important things every drummer needs to know. Thank you, Janice. I suffered tennis elbow in both arms many years ago. Sometimes still I have a little pain in my arms when I play a lot. Drumming, he means. I know he's a
Yep.
drummer.
Yep.
And he says, but more when I take the equipment like the hardware, which of course is heavy. And man, I hate moving my stuff and I
Or even
rarely
just
do it anymore.
screwing
Yeah.
stuff.
Yeah, playing with the
Like,
wing nuts. So
yeah.
there's that, but also we hear from Gene Bartholomew, who says, I've seen him in person, and that's really what he looks like, by the way. Gene says, yeah, I guess people need to know their body. I think mild stretching before a gig helps relax you. That's a good point. It could also
Yeah,
help up here.
totally.
Get your breathing in. I found 20 years ago, I was holding my breath while I played. I noticed that sometimes about me too, but what I
Yeah,
try to focus on
me
more
too.
consciously is like circular breathing, the way a horn player would, and almost like yogic breathing when I play, and it helps
Interesting.
my endurance and stamina by doing that. I've never been a
Sure.
smoker, so that's helped.
Sure. So I'm a pianist and violinist. So drumming can be very melodic as well. But sometimes what I do is I sing the line, or I breathe the phrase,
Yeah,
and then it forces you to take a breath at some point.
yeah.
Um,
Singing the lyrics while
so
you play drums helps.
yeah, totally.
Yeah.
So yeah, that's all really important. And so back like the tennis elbow thing, that actually could also be very connected, kind of going back to the shoulder, to what the shoulder is doing, because that's the foundation for the rest of the arm to function off of.
Right.
So oftentimes, and there's actually like research articles or studies that have been done to look at grip strength, based on where the shoulder blade is sitting, or the level of engagement of the shoulder blade. And there's a significant increase in grip strength, just like you turn it on, you turn it off, A, B test, same person,
Right.
etc. Where there is significant increase in grip strength with activation of the shoulder girdle, like the shoulder blade, and the position of the shoulder blade itself too, on the amount of force that's able to be generated. So if you have less force, let's say that your shoulders are kind of like rounded, like a lot of people's are,
Yeah.
then these muscles here aren't able to generate the force. But if you're
Mm.
asking your body to do, play really intense stuff, or grip a stick,
Yeah.
then those muscles are going to have to work harder, relatively speaking, than compared to if the shoulder blades were a little bit more solid.
Right. And we're covering shoulders and now lower back. That's
All right,
the new
let's do
name of
it.
the episode, shoulders and lower back. Let's go to lower back, because I know that I had lower back issues in my starting in my when I was like 33, but
Uh-huh.
totally unrelated to drumming, totally unrelated. So my point is
Yeah.
that I know what a sciatica is all about, how debilitating any back injury could be. I felt like I was 90 for about 10 years. It was
Yeah.
really a problem till I got past it. Walked with a cane for the first 3 months. It
That's
was
awful.
it was so immobile and in so much pain all the time. So I can relate to lower back pain, but I've never developed it from the way I sit or play. But
Yeah.
what contributes to that, Janice, from playing? Is it all posture or is it anything else?
I mean, it could be just like with most things, it could be a lot of different factors, right? And so when we're talking about the low back, we're usually talking about the lumbar spine. Let me hide this guy. So, you know what? Let me take away, let me just hang on.
By the way, folks, I just want to mention I'd love to hear from some people in the comments and let us know what you think of the way this is being presented by Janice with her modeling there and digging, literally drilling down into the anatomy and stuff. I find it's so interesting, and I'm hoping you folks do too. So feel free to chime in. Let
Yeah.
us know.
All
So
right.
now we're down to the bare bones, literally.
Now we're literally. So this is your sacrum. This is kind of like the solid bone that connects your pelvis to each other. Then you
Mhm.
have 5 lumbar vertebra, and then you transition into the thoracic spine. So this is really what we're talking about with the lumbar spine. And then, so most of the time when people have back pain, it's either coming from the joint itself. Sorry, let me go back. So the joint itself. So last time I think we looked at the neck before, but so
Yep.
the anatomy is somewhat the same. So when we talk about the joint in the low back, what we're really talking about is the junction between this portion of the top level of the spine connecting with the bottom level, this
Oh,
area right here. Okay. And then you have the same on both sides. You have a right joint and a left joint. And that's what allows us to have like rotation and bending to the
mhm.
side. Going forward and backwards, both of them move the same amount or the
Okay.
same way. Okay. So that's so people can get arthritis in these joints, which can be a source of pain. Let's go back to the last one. And then people can also get pain from the disc as it
Right.
pushes against the nerve. So the disc, what they are these kind of like cushy pads or shock absorber pads that are sitting between each level of the spine, and they really just absorb shock as we're moving throughout our day. But the walls of these, think about it like a jelly donut. That's the canonical analogy that you'll hear a lot of PTs use. There's like a structural wall, and then the inside is a little bit more squishy.
Mhm.
And so if there's a weakness of the wall at any point along this disc, so it's kind of like circumferential, right? So if there's any weakness along the wall of the disc, that jelly filling can kind of like pooch out. And usually when it does that, it kind of goes into this hole where the nerves, and you can see that in the yellow here,
Yeah.
kind of can push on the nerves. I know we've talked about nerves in different contexts before, but nerves in general hate to be compressed. They hate to be stretched. So, they can get really irritated if that happens. So that's another source of pain, is like the disc pushing. Also, in people who have arthritis, there could be like kind of bony growth or bone spurs that form as a result of that friction from the arthritis. That
Ouch.
also causes that hole that those nerves travel out of to narrow as well. So that could be another source of like nerve compression in the back. And then last but not least, probably the more common thing that I see in people with low back pain is maybe like a muscle spasm. Like maybe
Oh,
the least severe or the least serious of them all would be a muscle spasm of any one of these muscles here. In like there's a big network of muscles and they go from very superficial. If we peel more back, you can see just goes layers upon layers upon layers of muscles. And that's what allows our spines to be so stable and to be upright for long periods of time so that we can sit. We're not like flopping over, that kind of thing. So yeah, those are kind of probably the three major sources of back pain that I typically see. A lot of it could be due from posture. Typically, the ones that are like more disc related could be from posture. It could also be just how you move, or maybe you bent over and lifted something that your body wasn't kind of primed to do. It wasn't like ready for. So bending over and lifting something heavy, like kind of from the back, is kind of the classic way of someone kind of like blowing a disc, for example.
I had that happen from a sneeze. That's what my back.
So usually that's kind of like the straw that broke the camel's back,
literally,
for lack of a better phrase. Probably in those particular cases, it's not the sneeze itself that did it. It's like
it's just probably compromised from something else.
It was always kind of there, and then it just kind of like set everything in motion.
Well, the kids were little then, so maybe I was picking up a lot of kids.
There you go. The other thing too is like a lot of people will go, like if they get if they have back pain, or maybe like go get an MRI or something for their back. The thing to also remember too is that just because someone has a disc bulge in their back, it also doesn't mean that they're gonna have pain or they're going to have symptoms.
Oh, interesting. Okay.
It's not a one-to-one correlation, and there's been many studies in different body regions, but particularly in the back, where they took a bunch of people off the street or subjects off the street, like threw them in an MRI machine. All of these people don't have any symptoms, and then they give the MRI results or the readings or the images to a radiologist, and the radiologist is like going to comment on it, like they do, like a typical patient. And they're like, oh, this person has a disc bulge at L2, L3. They have narrow foraminal stenosis, blah, blah, blah. And none of these people have pain. And these are just kind of like incidental findings kind of thing.
So does it need to be treated in that case if there's no pain, or is it?
Not necessarily. I mean, but it kind of goes back to the discussion is like, should someone stretch preventatively, or should you only stretch when there is a problem, right? So there's humans in general are very reactionary versus like very preventative in the first place. So it's like, oh, I don't have pain, I don't have to stretch. Oh, I don't have pain, I don't need to strengthen, or whatever the thing is. So would they benefit from core strengthening and flexibility or whatever it is that they need? Sure, of course. But does it mean that it's going to get worse? Maybe, maybe not. Does it mean that they're going to have pain? Maybe, maybe not. Like, so that's kind of, I'll just throw that out into the universe.
Yeah, interesting. What's a good stretch for the back other than core strengthening, which I could see would be important for the back? What's a good stretch?
Yeah. So the one that there's two stretches that I really like. So one of them would be like a simple, like knee to chest. You're just bringing your knee to your chest. You're maybe like lying on your back so that you can relax into it. And the reason why I really like that stretch for a lot of people is because if the hips aren't mobile, because the hips are attached to the pelvis, right? So hip joint. If you don't have as much flexibility in the hip, and especially for drummers, because you sit when you're playing and you're using your hip muscles a lot. If you don't have good mobility in the hip, then it's going to translate to the pelvis, and then the lumbar spine is attached to the pelvis, so it'll follow wherever the pelvis goes. And so a lot of people when I kind of take a look at how flexible their bodies are, a lot of people surprisingly can't even get to like 90 degrees of like hip flexion, like pulling their knee towards their chest before their pelvis starts moving. And so then if you think about that within the context of just like sitting in a chair, most people are going to be close to that 90 degrees. So that means if they start moving, if their pelvis starts moving at 90 degrees of hip flexion, they're already at like 95% of their available range of motion before their pelvis starts going along for the ride, which then will cause the back to be in a more flexed position, which will put more force on the back in general.
Very interesting. Barry is chiming in saying, I took a lot of physiotherapy for some time for a total right hip replacement surgery. This is the type of explaining that my therapist would do. Great video chat. Thanks very much, Barry.
Great.
Appreciate that.
Sounds like
Thanks
you had a great PT. That makes me
Yeah.
really happy.
Is he your cousin or something?
Must be.
No,
So
that's
the
great.
other, there's one more stretch that I wish everyone and their moms would do. I have to find it though. I'm going to add one more muscle in. Oops. Okay. So it's this complex right here. So, and this is especially what drummers need to pay attention to. So these two muscles, so there's a muscle on the inside of like the cup of your pelvis. You can kind of get the upper rim of it if you dig your finger, if you hook your finger in there. And then really deep is this other muscle, the psoas major. These two muscles join together to make a tendon way down here. And then when those two muscles contract, they lift your leg up. And most drummers, or at least kit drummers that I know, do a lot of pedaling. Do you hover? Do you not? I know we had a discussion on the hip a couple months ago.
And then you got the people in drum corps that are marching.
Oh, I mean, that's a whole nother, that is a whole nother beast in itself. Yeah, that is no joke. Yeah. So anyway, so not only do you need to have good mobility of the hip to bend it up towards you, but these muscles in drummers get overused a lot. And the more someone overuses a muscle, the tighter it tends to become. So then what happens is if these muscles are tight, then what it's going to do is it will either pitch the pelvis forward, roll it. If you can see my arrow, it's going to go like forward, rotate this way so that you're going to have a little bit more arch in your back. But then also this guy just attaches on the entire lumbar spine too.
Yeah.
So just like what we were talking about with the shoulder, if it's tight, it's going to pull the spine along for the ride. Because the skeleton is a passive structure. It's just going to go wherever the muscles tell it to go. So doing a stretch for the hip flexor is going to be super key. There are videos online. You can find, I have an old video of me doing it on my Instagram page from like pandemic days. And you can do like different variations of it, which I find that are really, really helpful. But a lot of people are tight both in this muscle and in the back. And so their hips just becomes like a block, basically. They can't move too far forward, but they also can't move too far backwards either because of the tightness of the muscles. So if I had to stretch something for the back, it actually would be at the hip, but it will free up a lot of movement for the back.
Very enlightening. Hope you got a lot out of that, folks. If you didn't see the whole episode, watch the first part where we covered the shoulder, fascinating part of the body, and lower back. And our next show, yes, I have to peek, is on August 29th at the end of the month. So you got plenty of time to get injured and ask questions during the next episode. It's at 1:30 Pacific. And
hopefully not.
We're going to talk a lot about the nervous system and how it gets affected by repetitive motion injuries and drumming, especially, and things. And then the episode after that is going to be September 19th at 1:30 Pacific. And we will let you know what that topic's going to be as we get closer.
Yeah, or we could do another shoulder and back day again to round it
and if
out.
people, you can always chime in and say, hey, I've got this issue, and ask questions. Or if you're seeing somebody or that you've got arthritis, bursitis, carpal tunnel, tendonitis, any of the things within Janice's area of expertise, she can answer those. And if they're out of her expertise, I've seen her. She is great at making up some bullshit answers.
That's
so
true.
Feel free to ask away. Just kidding about the last part. And
No,
this is
I'll say
science.
if I don't know something. I'll say it.
Yeah,
I
and it's
admit it.
truly science because I realized I'm wearing this shirt and this was not planned, but my shirt says the scientific method. F around, find out. We're not suggesting you do that with injuries, okay? Just like learn from a professional like Janice. Her channels are tagged in the description, and she's based out of Los Angeles, and she does remote counseling as well. So there you
That's
go.
right. I'm a
Thanks,
busy
everybody.
person.
We'll see you again soon with more Drum Talk TV fun. Thanks,
Yeah.
everyone.
See y'all next week or next month.
Next month.